Hello everybody, this is Ahmed Adel Saada from IAKI Junior Member Working Group. Welcome from Serene 2017 at Düsseldorf, Germany. It's my pleasure to welcome Professor Mullol. He is a director of Rhinology Unit and the Smell Clinic, ENT Department, University of Barcelona. Thank you very much for accepting our invitation.
Thank you for your invitation.
Okay. First of all, I would like to ask about what is the main objectives of this study?
Well, we know that in adults, and we know in also in children, that a number of patients don't respond very well to regular treatment, and we thought that maybe there were other causes apart from the severity of the disease or the comorbidities such as asthma or severe phenotypes or whatever. And we were focusing in the obstructive disorders of the nose, adenoids, hypertrophy, turbinate hypertrophy, nasal deviation. This is studied in a group of children and adolescents that probably is different from children to 6 years to 17 years. And the objective was to determine the prevalence of these obstructive disorders in the nose in children and adolescents, and to see how this was related to the lack of improvement after medical treatment.
Also, I would like to know about the methodologies you have used in this study.
Well, first of all, we use regular methodology, but mainly we use the area classification. We use the area classification that has been validated also in our group for children, in intermittent, in persistent, in mild, moderate, severe. We use this classification. We also use the typical methodology for BAS score in all the symptoms. And also we used validated tools to measure the obstructive impact of turbinate hypertrophy, nasal deviation, and adenoid hypertrophy. All the tools that we used were mainly, or has been mainly validated.
Thank you. Also, I would like to ask about what are the main outcomes of this study?
Well, the main outcome was the answer to the question: your symptoms have improved or not after the medical treatment that you have received during these 2 months. This treatment was based on what is recommended in guidelines for allergic rhinitis, either the European guidelines for children or ARIA, and that was the main outcome. And they or their parents responded if they improved or not. And we categorize the patients in responder and non-responders. Then the other outcomes was to see what happened with the nasal symptoms, if they improve, what is the difference between the 2 groups, and also what is the prevalence and the association of obstructive disorders, turbinates, adenoids, and septal deviation, the association with the non-responder group compared to the responder group. These are the 3 main outcomes that we tested.
Yeah, thank you. Also, I would like to know from you which the most important predicting symptoms of the failure of treatment in case of the allergic rhinitis.
Well, this is difficult to say. In this study, when we did the multivariate analysis, and you can show there is a table showing that, the symptom was mainly associated, or was stronger in association with the lack of effect on medical treatment, was nasal congestion. And actually we were looking for obstructive diseases, with obstructive impact. However, we know also that the loss of smell is a very nice and very reliable symptom that is mainly linked with allergic rhinitis severity. And we have published in the same journal 3 months ago another paper showing the impact of smell and the importance of the association with severity, as we have done before in adults.
Great. And also in line of this finding from your study, what is your suggestion for the clinician when they treat persistent allergic rhinitis in children?
Well, actually, the conclusion of the paper says that there is a strong association of these structural disorders, turbinate hypertrophy, nasal deviation mainly, yeah, and in second place adenoid hypertrophy, with the severity and with the lack of response to medical treatment. Yeah. And our advice to all the doctors, to all the pediatricians, is that in addition to doing a good diagnosis, a good classification, recording all the comorbidity of the patients, they have to look inside of the nose. Yeah. They have to learn endoscopy. Allergologists, pediatricians who work with disease of the nose, they have to look inside and to see if there are hypertrophy of adenoids, if there is nasal deviation, or the patients have also turbinate hypertrophy, because some of these patients will need a kind of surgery to solve these problems.
Thank you very much. I agree with you, and thank you for this valuable discussion with you. And thanks again for giving us the opportunity to have an interview with you about your recently published journal publication. Thank you very much.
Thank you very much for considering this work. I think it is very interesting to be disseminated in the IACI website. Thank you very much.
Thank you very much. Thank you.